Good afternoon once again. Sawasdee krap. So today is the 25th of December 2020, and I'll give a brief summary of the Thai version of the press briefing held just now. Of course, today, in a few days, the world will be reaching around 80 million infected persons globally. Thailand remains at number 144 around the world. And before I begin, of course, wishing everybody a happy, very Merry Christmas from the Center for COVID Situation Administration here. We have been operating for around 9 months now, and it's December now. Not exactly how we planned to spend Christmas Day or New Year's Day, in fact. But of course, COVID-19 is not taking a holiday, and neither are we. So, of course, a time for hope during the holiday seasons. I'd like to just give some short positive messages first. Just 3 points. First is that even though health authorities have advised us to maintain physical distancing, we're actually more united than ever in combating this pandemic. Secondly, we found once again that coming together, of course, makes us stronger. And in times of crisis, that can bring out the best in us. Thirdly, the CCSA remains confident that such community spirit, together with disease control measures, will be able to protect the health of everybody, both the general public, foreign nationals, Thai nationals, migrant workers, to contain the virus. Of course, Thailand is doing its best to take care of all communities. Inclusiveness was the key word throughout the year. The relevant authorities continue to take care of all groups, including the migrant workers in the Samut Sakhon cluster, and are compensating them for their time away from work as well, the relevant authorities, as they would do for Thai labor. Just a little bit on the migrant workers in that cluster. Thailand, the Thai government is following with concern and with the hope that our Myanmar brothers and sisters who have been affected by COVID in Samut Sakhon will recover soon. Of course, the Myanmar migrant workers are an important part of the Thai economy. We mentioned that often. And it is clear, of course, as Myanmar is a fellow member of the ASEAN family with Thailand, and there are many Myanmar citizens working and living in Thailand, not only as migrant workers, but also as teachers, as students, as professionals in Thailand. As for the situation, just to repeat again that the situation is manageable. We have our medical and public health capacity, which we believe will be effectively able to contain the virus. The spokesperson, Dr. Tweesin, reiterated about the disease control zones, which we talked about yesterday. The meeting yesterday at the CCSA discussed the 4 categories, and I'll just go through that briefly. Again, just to reiterate the classification. The first is, of course, highly controlled. Second is controlled. Third, under high surveillance. And fourth, under surveillance. The highly controlled ones have a considerable number of cases of local transmission. Thus far, only Samut Sakhon is included in this category of highly controlled zone. And the related measures for this group includes active case finding, close contacts, active case finding in areas with close contacts of reported cases, and business establishments at risk, fishing boats as well. Isolating the cases by setting up field hospitals according to local capacity, temporary closure of public spaces, restricted movement into and out of the zone. So currently this applies only to Samut Sakhon province. And of course, for New Year celebrations, banned except for online activities. This is for the highly controlled area, which is relevant for only Samut Sakhon at the moment. For controlled areas, which Bangkok is in this category, and a few other provinces in the vicinity, these include zones which border the Samut Sakhon or have more than 10 cases and is on an upward trend of local transmission. The measures for this group would be active case finding with reported cases. Also, establishments considering to reduce the opening and closing hours as necessary. Checkpoints along the border with highly controlled zones. The employees traveling from highly controlled zones to the controlled zones are to work from home. Public activities where the number of people cannot be controlled would not be allowed to take place. and activities with a high number of participants, which can be controlled, can go on, including activities within the family and within group of friends. So those are the two top groups. The other categories are high surveillance and under surveillance. Most provinces in Thailand still remain under the high surveillance, which is tier 3 actually, category 3, which means that no more than 10 cases are in those provinces. Most provinces in Thailand remain there, and they are able to manage the situation. The measures include work from home, online learning, avoiding activities with many people, and New Year celebrations can be held but downscaled or downsized. And the fourth here, the last one, the one with the least worry, is the group which is under surveillance zones with no cases yet. Considering these zones are to consider closing or restricting opening hours if a risk arises, avoid organizing activities with many people, as well as for New Year activities, those can be held, of course, downscaled as well. So as you can see, different measures apply for each zone depending on the context, the severity of the situation. I'll move on to the general situation and the numbers that we have for today. A slide will be coming up for you. For the new confirmed cases for today, we have 81 new confirmed cases, making the total cumulative since the beginning of the year in Thailand 5,910, with total recovery of 4,130. And for fatalities remaining at 60. Some observations of this number, 81, 37 are from local transmission, 35 are from active case finding in the migrant worker community, and 9 detected within the state quarantine. So as the spokesperson mentioned, there are now COVID cases in 31 provinces as a result of the Samut Sakhon cluster. 31 provinces, but this number may be fluctuating. We are double checking the numbers. The number of provinces affected might be higher than this, a few provinces higher. Right now in Samut Sakhon, there had been active case finding for today, 8,800 tests, wherein 1,300 plus have been found to be positive, which include only which is a rate of only 15% positive, which is lower than the 19% that we had yesterday. The majority of new cases were still contracted via close contact history with previously confirmed cases at the shrimp market in Samut Sakhon. On tracing and testing, at-risk people who wish to be tested for the virus can receive the free test at any hospital, but those who want to be tested but have not been exposed or at risk to the virus would have to shoulder the costs themselves. The government is also planning to approve the use of the Mochana application as another additional tool to the existing contact tracing application, which was used this year, which is the Thai Chana application. This will be a more advanced version of the Thai Chana application and aims to strengthen the capability to curb the spread of the virus and to monitor and track. This is jointly developed by the public and private sector in Thailand. It can also help identify individuals in close contact with those infected by using GPS signal and Bluetooth technology to pinpoint the location where they have been. And we're also continuing to be proactive, performing targeted testing in seafood markets, in factories and other construction sites around Bangkok and other provinces to ensure that the areas are safe from COVID. As mentioned about migrant workers, the Ministry of Digital Economy is also working closely with major mobile operators to update information for the migrant worker community through SMS messages as part of the effort to curb the virus. These messages will be available in the language the Myanmar, Khmer, as well as English languages. And the 1422 call center contact number will also be included as information in the SMS messages that will be reaching out more to, in a wider scale, to the migrant community. For the quarantine restriction measures, many people are asking for intra and inter-provincial travel within the provinces, between provinces. The government and each province will only apply quarantine and other restrictive measures only when deemed necessary to ensure minimal impact on the people's daily lives. Moving on to entry into Thailand, of course, the Ministry of Foreign Affairs continues to facilitate the repatriation of Thai nationals and foreign nationals returning to Thailand from abroad. So from the period of April until yesterday, until December, around 190,000 people, both Thai and foreign nationals combined, have entered the country, screened, and placed into the mandatory quarantine system. This is both Thai and foreign nationals, totaling 190, almost 200,000. So we're happy to learn that many of our friends overseas are coming back to Thailand, hope soon under better circumstances. Concerning the new normal lifestyle, the increased number of infection in the past week, we should not, of course, not forget that we now have better knowledge and better understanding of COVID, of the nature of COVID today. And we have also learned how to live with this disease under a new lifestyle, a new normal lifestyle, and learn that we can protect ourselves by following the preventive measures. Two important points that the spokesperson mentioned. The first was that there were certain complaints, certain information received that some foreign nationals living in Thailand did not agree to wear masks while in public. And the complaint was from certain business establishments wherein they reported that when they advised the foreign nationals, our foreign friends, to wear these very important masks that we still have to wear, they would refuse to do so and say that it's not necessary. So just to reiterate that it is necessary, this is an established fact, accepted around the world already. And for Thailand, of course, it is a necessary measure. As I mentioned yesterday, the acronym DMHT, D is for distancing, M is for mask wearing masks, H is for hand washing, and T is for testing, which means temperature checks. So the DMHT formula is mandatory in Thailand. So we'd like to request for your kind cooperation, no matter who you are. If you're a Thai national, if you're someone who calls Thailand home, a foreign national, please continue to abide by the regulations, the measures, and wear these simple, low-cost, but very effective and very important masks while in public, while you are staying, living, or visiting Thailand. So 100% masks, just to reiterate that. The second issue is about the Republic of Korea, wherein we have received news reports that a number of Thai nationals, around 31 Thai nationals, have been found to be infected with COVID in the town of Cheonan in the province of Chungcheong in the Republic of Korea. This area is around 80 kilometers from Seoul. And the Thai embassy, of course, rest assured, is taking care of these Thai nationals and in coordination with the authorities of the Republic of Korea. Just in closing, our priority now is to cut off the cycle of the epidemic as soon as possible. And to do so, we need everyone's cooperation, need everyone's attention in stepping up the preventive measures by observing personal hygiene and communal hygiene as well, and avoiding large gatherings. And don't forget the acronyms, the DMHT guidelines: distancing, mask wearing, hand washing, and temperature checking. DMHT. If you start having symptoms, of course, please consult the nearest hospital and provide information on your travels, be it inter-province or any contact history. So please take care to ensure that we are all COVID-free, maintain social distancing. I believe that it's very important to end, of course, with a positive note because it's Christmas Day and we're almost near New Year. Of course, Santa Claus and his crew are following all these measures themselves as well for a safe Christmas. We'd like to give encouragement, your inspiration and moral support to all of you so that you can enjoy Christmas at home with your small group of friends. You can hang gifts and also hang a mask or alcohol gel and all these necessary things which are really relevant for today. So we may be physically and socially distanced, but of course we'll not turn into strangers. We hope that you have a very happy holiday today and of course until the end of the year, which is New Year. So Merry Christmas, Joyeux Noël, Feliz Navidad, Sawasdee krap. Thank you for your attention.